All right, this is PowerPoint 7B. B is in bullet, Bravo. So we're going to talk about vertebrae. And the vertebral column goes from the skull down here to your pelvis. And then, of course, we have our sacrum, which is made out of fused vertebrae, and our coccyx, our tailbone. Right. But anyway, we call this the spine. That's straightforward. This is how we take the weight of the whole body and push it down to the lower limbs, supports us. Just like when we did function for the skeleton, we have attachment points for ribs, we have attachment points for all the muscles. Those attachment points are the things that we're calling bony landmarks. So I said, oh, you're going to need to know the bony landmarks for the test. Is that clear? All right, so the spine, 26 irregular bones. Remember, we had 4 categories for classifying bones. They were long bones, short bones, flat bones, and irregular bones. These are all irregular shape. They have a complex 3D shape to them. And there are major portions. We have the neck ones, we call the cervical vertebrae. We have the thoracic vertebrae. There are 12. Lumbar, then sacrum and coccyx, which we already mentioned. The sacrum is fused vertebrae, and the coccyx, your tailbone, is also fused, but the sacrum and the coccyx are not fused together. Now, you will want to remember for the test that there are 7 cervical, 12 thoracic, and 5 lumbar. Good? You want to know that. And, not that you care, but real quick aside that I pulled up here, showing you the difference. You know how long a giraffe's neck is? It's got the same number of vertebrae that we do, they're just much longer, much bigger. So there's 7 vertebrae. All right. So 7 vertebrae, 12 thoracic, 7 cervical vertebrae, neck vertebrae. And you might say, what's cervix? I thought cervix was like a genital thing, a reproductive thing. Cervix in anatomy is a narrowed area. Your neck is smaller than your shoulder, so it's a cervix, cervical vertebrae. Are we good? All right. So, moving on. You have curves in the spine, all right? Cervical curve, lumbar curve. So here we have our vertebrae. Cervical curve, the next curve a little bit to the anterior, okay? And here, lumbar, it's pushed way out. If someone had an abnormality that was pushing it way out, we would call that a lordosis. But we'll talk about scoliosis, that's where it's curved side to side, and lordosis. We'll talk about that stuff later. If the lumbar was pushed way out, that would be a lordosis. Anyway, the sacrum is curved. That's right here, in between the pelvic bones, and the coccyx, the tailbone. Again, we've talked about this before. The new information on here is that the coccyx is fused, 4 fused vertebrae, and that the sacrum is 5 fused vertebrae. Other than that, you've heard this. You know that between the vertebrae that are not fused, we have intervertebral discs. You know that those intervertebral discs are fibrocartilage, which means they're tough on the outside, very resistant to impact, squishy on the inside. Good? All right. So let's jump in. If you look right here, you can also see differences in the spinous process. These cervical vertebrae can have a big spinous process. So does the first one of the thoracic vertebrae, but a big spinous process. We orient it the same way. big spinous process because we have muscles attaching there, big muscles, so we can move the neck around. But we have that here in the thoracic vertebrae. Still have a big spinous process. It's getting smaller as you go down, but it's also getting more pointed towards the posterior, more pointed down towards the butt. See that? Okay. Lumbar, the processes are big and chunky. See how they're almost rectangular in shape? Yeah. One of the possible questions I could ask on the test, I could put several different types of vertebrae, and I could say, what is this? Which one of these is a lumbar vertebrae? Which one of these is a thoracic vertebrae? That's a valid question. Does that make sense? All right. So let's continue through. Ligaments. If you remember, I told you that ligaments link bones together, right? Ligaments link bones. So, you have ligaments that help support the vertebral column. They run along it. You have front ones and back ones, the anterior ones towards the front of the vertebrae, posterior ones towards the back. But they're continuous. They go from up here down to here, and they help keep things in place. They prevent you from over-flexing either direction. At least they're supposed to. And the ligamentum flavium connects the vertebrae together. So we're going to look at pictures of these now. What? Yeah, sure. They cut it. All right. So you might say, what are all of these sticking up for, these spinous processes? There's a ligament that runs down there, a sheet of connective tissue that every one of the spinous processes is connected to. Now between the bodies of the vertebrae, actually this would be the body, between the processes we have that ligamentum flavium we were just talking about. So towards the butt down, we call that inferior articular process, and that would articulate with the vertebra below it. At the top, we're going to have a superior. If they're not showing it, there should be a superior surface. You can see it right here. It's not labeled right there. Let's see if they label it here. They did not. Okay, but what I'm saying is you have, this is that inferior surface. You see it? Inferior articular surface. Right below it, the next vertebra has a superior surface that rests against it. Those articulate. What that means is they're covered with slippery cartilage so they can move back and forth. That's what lets you move your vertebrae. Are we good? Yep. All right. Now, anterior longitudinal ligament, that is on the front of the vertebra. You've got a ligament that's running around like this. Good. And right here, we have the, are we showing the posterior? Okay, yeah, showing a posterior. So right there, it's below the transverse process, below the spinous process. It's on the vertebral body. We have the posterior ligament. Good? Everybody with me? Yep. All right. So the vertebral disc, intervertebral disc, this is one of them. I mean, they have it labeled here as intervertebral disc, but it actually has parts. The fibrous part, I know we say it's made out of fibrocartilage, it is. It's got a tough fibrous part to resist impact, and that's called the annulus fibrosus. And that has a squishy middle. Think of it as like a gel, okay? And that would be the nucleus pulposus. Good? So, squishy middle, nucleus pulposus. tough fibrous outer covering, annulus fibrosus. Are we clear on that? All right, so let's move on. Looking from the back here. No, this is looking from the front inside, looking like this. So I'll put it here so it doesn't block the picture. So you're looking at vertebra like that. The anterior ligament is on the bodies of the vertebra, right there. Okay. The posterior ones are back here, one there. This side, below the processes. Actually, I think above the ribs. I can't get my hands there, so let me turn it this way. Like that. All right. And you already know intervertebral disc. You've got this. This picture is anterior view, so it's the view from the front. So intervertebral discs, you already saw the picture. You know they've got two parts. The nucleopulposus is a gel. It's the inner part, the nucleus, like the middle, gel-like middle, pulpy. That's what makes it squishy, okay? That's what makes it squish. Just like gel in a pair of sneakers, same thing. Like, oh, that gel, it helps resist impact. I can jump better and land without it hurting my feet. Well, it's gel in the middle of your vertebral disc. The outside is collagen and fibrocartilage. That stops the gel from squishing out too much and letting the vertebrae touch. So tough fibrocartilage outside, annular fibrosis. Nucleopulposus in the middle, that's the squishy part that absorbs the impact. Are we good? All right. Now, this is where I would say take out that piece of paper. Okay? I'm not saying you need to do it right now, but where I told you, fold the piece of paper, so you fold it in half and you fold it in thirds, and now you have 6 squares to work with on each side. I would draw it and see if you can label all the parts. And then I'd look at the picture. Oh, I drew that one, but I didn't know the name of it. The next time you draw it and label all the parts, you'll get the new name. The next time you draw it, you're like, oh, I don't really have that drawn right. I didn't put the transverse process in the right way. I made it more flat than it is, more up. Does that make sense? So how you study, I would recommend taking this. I have a few more blank pieces of paper up here. I have a very few now to the left, but you can use them to study bones. All right, so let's go over these. The spinous process of the vertebrae sticks upward. Good? Towards the back. All right. The transverse sticks out to the side. The angle will depend where you are on the vertebral column. All right. The body is right here, but they have a disc in front of it. And that disc, they're showing the middle is the nucleus pulposus. Around the outside, you see all these fibers going that way. That's the annulus fibrosus. This is showing a damaged disc, a herniated disc. You've heard of that. That's an injury that athletes sometimes get. This is the herniation. This person landed on their spine so hard that when it squished, the fibers gave, and the pulposus went stuck out there with sound effects. Okay, not with sound effects, but you get the idea. All right. So you know that the herniated disc is pushing on this spinal nerve. That's why that person is having a lot of pain. Does that make sense? Yes? No? You with me? All right. I'm going to move on. So here we have our herniated disc. You see pieces squishing out, pinching the spinal cord. Here we have normal discs. Everybody good? So this is just the actual radiograph of what the pretty picture was showing you. All right, so if you have severe spine trauma, you can get herniated disc prolapse, okay? This involves rupture of the fibrous outer covering, the annulus fibrosus, and then the pulpy middle pushes out, presses on the spinal nerves. Everybody good? All right, Dean, check this out. This is horrible. So I'm going through describing this, and this one they drew herniated. It has the middle of the disc with the soft squishy part shoving out like that, pinching the nerve. So that person's going to be in horrible pain depending on where in the body, depends on where they get the herniated disc. But this herniated disc is pinching the spine off right there in the sacrum, so probably everything there down.
So probably from, what is that, is it L1?
Let's see, since this is sacrum, I would say, yeah, probably L1, unless with this coming up here, it might be that this is L1 and that's L2. Yeah. So, but yeah, that's what a herniated disc actually looks like. And what we just said is it's when the nucleopulposus, the squishy middle of the disc, pushes through the annular, the fibrous part. So. All right. So homeostatic imbalance, what happens when this goes on? Rupture of the annulus fibrosis, the outer layer, resulting in protrusion of the middle, presses on the nerve, numbness or excruciating pain. How they treat it: exercise, massage, painkillers, heat, and you might have to do surgery. Hopefully not. The thing with surgery like that, it usually doesn't work well. It's like it'll probably just go downhill from that. You're going to end up having spinal fusion where they use pins to hold two vertebrae together and try to stop it from articulating. Anyway, moving on. So abnormal curvatures of the spine. We talked about this already. Normal curvatures. How you've got a little bit of a curve there on the neck, on the cervical vertebrae, a little bit of curve on the thoracic vertebrae, a little bit of curve this way on the lumbar vertebrae. We're going to talk about what happens when you have extreme or weird or different curves. By the way, while you were out, one of the things that I said was I talked about how these vertebrae look different from those, look different from those. Like here in the lumbar, we've got very squared off, chunky spinous processes. Here in the thorax, we have very downward pointing spinous processes. Here in the cervix, most of them, not obviously the atlas, but most of them, cervical vertebrae, we have narrow spinous process that sticks straight out. I said one possible test question would be to put out a couple different vertebrae and say, hey, which one is the lumbar or which one is the cervical? So be prepared for that.
What is it? Is it like 12?
7 cervical, I think 12 thoracic. Yeah, let's jump back here to this picture where it was.
Yeah, 7.
Yeah, right there. 7 cervical, 12 thoracic, 5 lumbar.
Can I take a picture of this for?
Yeah, sure. Everybody should if they didn't before. But I mean, you know, you have access to this PowerPoint and Moodle too.
Yeah, I was just having an argument with my friend last night. He's in AP2. He was down hard arguing me that he basically switched the cervical and the lumbar numbers around.
Oh, yeah.
So he thought there was 5
No,
to 7.
even animals with really long necks. That's something I said. I don't think you were in the room. Were you when I pulled up the giraffe? Even a giraffe, as long as their neck is,
They probably still have the same number.
they do. Their neck's as long as a short human, but they got the same number of vertebrae. So, yeah, that's kind of and there are other weird variations. like that. A lot of dolphin species, their cervical vertebrae are fused, like our sacrum is made out of fused vertebrae. So they don't have a lot of neck movement. Now, that's not the most common dolphin that everybody knows, the bottlenose dolphin was like Flipper the dolphin. It's partially unfused. Anyway, so you've got to know you've got to know parts like the spinous process, the transverse process, the body. You're going to know the ligaments that hold the vertebrae together, then overextension in either direction, overflexion in either direction. Know the number of vertebrae. Are we good so far? All right. So now let's, okay, they do have pictures. Okay, so at normal spine curvature, scoliosis is lateral movement side to side. The thing flexes where it shouldn't. That would be scoliosis over here, where the person has an abnormal flexion in their spine side to side. All right, kyphosis. This is something a lot of older people have. If they get osteoporosis and their vertebrae start compressing and breaking, you're going to end up like that where they're curved over. All right. Lordosis is where you have this natural curve in the lumbar is way extended and you have this pushed way forward. In the case of that pregnant woman, it's because she has so much weight in her womb pulling downward with gravity and pulling her spine forward. Does that make sense? All right. So moving on. We're going to talk about parts of the vertebra. Go over the picture and then we'll go back. We have the body. Okay. We have the spinous process we've already talked about. We have, this is facing up, the head would be there. And the reason we know that is this is the superior articular facet. Let's look at one of these in comparison. So, the body, that's not blocking the screen, as you can see. All right, so the body is right here. Everybody sees that? The superior articular facet is what's pointing upward, and it's going to meet up with the vertebra above it. All right. The spinous process is the one that's sticking that way. Remember, the shape of the spinous process is a big diagnostic feature. The vertebral arch is, we got this hole where the hole, the vertebral foramen, where our spinal cord is going to go. The arch over it, this whole thing is a vertebral arch, and it has two spots in it that connect the processes. So we have a transverse process, a lamina, a spinous process, a lamina, a transverse process. The whole thing together is a vertebral arch. Everybody good? That's another type of question that could be asked. What is this? All right, so continuing. One of the things that's mentioned here that hasn't been mentioned before, the transverse processes have holes in them, the transverse foramen. So, cervical vertebrae have holes here. This thing here is extended all the way down and has a hole in it. That hole is for the basilar artery. You have two, actually for vertebral arteries. You have a vertebral artery on each side, named because it goes up through the vertebrae, and then they fuse into a basilar artery. Those carry blood to the brain in a thing called the circle of Willis. You know how NASA, like, we're going to send up a space shuttle, we got to have, like, don't just have a computer do a thing, we got a backup for it. So we got a backup to the backup. Would you say the brain is the same level of importance? You got to keep it running. So, blood flow to the brain. You can send it up a carotid artery, a vertebral artery, a vertebral artery. You you've got 4 ways of sending blood up to this thing called the circle of Willis. So if blood comes up any one of them, you're still supplying blood to the whole brain. Maybe not in the same volume, but you're still supplying blood. It's a way to try to keep going. It's your body's backup plan. So that's what you're seeing in red. The vertebral, let me move it here so it's easier. The vertebral arteries are in red. They're going up through these holes, the vertebral foramen. Or sorry, the transverse foramen. Okay. So we have these transverse foramen that have the left and the right vertebral arteries that go up and they fuse inside the skull to the basilar artery that goes up to the circle of Willis. Don't worry about the names of all the blood vessels. You'll get that later on in AP2 when we do circulation. But what you need to know right now is that if you see a transverse process that's really chunky big and it has a hole in it, that is a cervical vertebrae. Good?
Can you go back like one slide?
Yeah.
What are the characteristics of the cervical?
That's probably what you're talking about. Back 2 slides?
Yeah, that one.
Yeah.
Thank you.
All right, now this one, remember I said, I could show you different vertebrae and say which one is this, which one is that, you know, is this a thoracic, a lumbar, a cervical? If you memorize what's on this table, it's table 7.2, it'll tell you the characteristics of every vertebrae. The reason I jumped ahead to that picture was to show you the holes. Good? All right. This is showing the same thing from the side. You remember I said lumbar, the spinous process, is chunky and rectangular? And thoracic, the spinous process is pointed downward and it's huge. In the cervical, it's a lot narrower and shorter. It's still kind of pointy, it's still pointing kind of downward, but not as extreme of an angle as in the thorax, and it's not as big as in the thoracic vertebrae. Is that clear? All right, and that's, again, table 7.2. All right, so let's look specifically at thoracic vertebrae. The one at the top is the atlas, and it rotates around. The one below it has a part, the axis, has a part that sticks up we call the dens. Dens means tooth. So this tooth-like thing sticking up, and everything rotates around that. So if you look at the axis, it has bone, 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 but here it has a ligament. It goes from one side to the other. That makes a little circle, a little hole that the den sticks up through. And the atlas is special. It holds the skull, just like in mythology, Atlas would hold the world. Okay? The atlas holds the skull, and when you turn your head, that vertebrae goes with it. The atlas turns with the head. Okay? When you look right here, one of the other things that you can see not on C1, but on C2, the axis, C3, C4, C5, C6. See how the spinous process has a little bit of a fork to it? A little bit. Here it just looks a little wide with a little extension. But the idea is if you see a spinous process that's forked, that's another cervical vertebra thing. Good? All right. So, we've got that. C7 is not forked, and it's kind of pointed downward. That's considered to be a cervical vertebra, but it's the dividing line between cervical and thoracic. So the axis is special, no body or spinous process. It's got the arches. It has the The superior surfaces are articulated with the occipital condyles. If you remember, day before yesterday when we were talking, we looked at the skull and we had the foramen magnum, the big hole in the skull, and then we had the occipital condyles below it. The occipital condyles were the big bumps on the side of the foramen magnum. This atlas holds the skull at those two occipital condyles. That's where we carry the skull. And this is what lets us move our head like this. But when we move our head like this, that vertebra goes with the skull. The skull turns left or right, it doesn't go with it. All right, so there it is. Remember, these superior facets are like the arms and shoulders of Atlas holding the world up. Good? And also remember, this turns with the skull. You good? You good, Cliff? All right, moving on. Now, this is looking at it from the bottom. Obviously, it has inferior articular surfaces that articulate with the axis below it. So the axis has the dens, that sticky uppy part, named tooth. It's still missing a body, but this, the rotation around the dens, is what lets you move your head side to side. Let me pull up some pictures. This is the axis right here, resting right against the skull. And you see this white part sticking up right there? See that? That's the dens. The ligament that lets you rotate your head side to side goes across between these two, where the two skull condyles are. It goes across the atlas from one side to the other, from one superior articular surface to the other. Now look at C2, the one right below it with the dens. See that dent sticking up, and you know there's a ligament around it on one side, and three sides there's bone. Is everybody good on that? Those are just pictures straight out of Wiki. You want to look at them. There's some really good pictures of Atlas and Axis with all the parts in it. Anyway, let's jump back in. So here we have spinous process, lamina. We don't have much of a transverse process, so it's this little tiny bump right here. But we do have, instead of a body, a dens sticking up. That's what the skull and the C1 rotate around. Yes?
So we're going to have a test on like all of this,
Yes,
right?
every
Like,
single bit.
all of it?
Yep.
Okay, so have you thought about maybe doing like some kind of like worksheets or something to like help us better like...
If you had been in here a
memorize?
moment ago, what did I say when you were talking about the amount of stuff? Good stuff.
He's gonna pass out like a survey.
And
Oh,
you guys
survey?
can fill out things that you think are suggestions that would make it easier. So instead of jumping in the middle and trying to go through lectures, yeah, just save it and write down suggestions.
Okay.
Because I totally agree. We need to have higher retention than we had.
Right.
We need to make it easier in some way. So we're on the same page there.
That's good.
Just don't jump in here.
Right. Gotcha.
Cool. All right. But yeah, the other thing that I had said, you remember that sheet of paper with the 6 squares?
Yes.
Yeah. If you go through the trouble to draw and label that 12 times, that one bone, you'll know the parts of that one bone.
Okay. Also,
No, it's not extra credit.
I went to the library to get those books that you said.
Yep.
And she said, we can't take them out
That's
of the
right.
library.
That's right. You have to stay there.
Right. I didn't know that though.
Yep, but that's the way it works.
I know that now.
I'm sorry that wasn't more clear
It's
before,
okay.
but yeah, that's the
You know,
plan.
It happens.
Okay, so moving on. All right, if you look at the superior photo, we had the pretty drawing of it here. Here's an actual photo of the same bone, same features, just like we had before. All right, here you can see the transverse ligament, that very important ligament that goes across. So we have the dens sticking up, we have the transverse ligament. The axis turns, sorry, the axis is here with the dens, and the atlas turns around it with the skull. So how does the skull get all this movement? We've got two vertebrae involved. Nodding is the articulation between the atlas and the skull. Turning your head side to side, that's moving the atlas and the skull around the dens of the axis. Is that clear? Pretty good? All right. And were you guys in here when I said that if you memorize this table 7.2, it will tell you, because I'll probably have a question, which kind of vertebrae is this? And you will be able to answer that if you know things like the spinous process points downward more in the thoracic and it's more chunky in the lumbar. Does that make sense? No? All right, we've been over it before. Let me try again. Did you hear the words coming out of my mouth before? No. All right, and you know it's being videotaped, so you'll be able to watch it again many, many times if you want, right?
You don't put those on YouTube?
Already are. Not this one right now, but the one from yesterday already is. I already put it in Moodle. Did you see it?
Yeah.
Yep.
I see you.
All right, all right. Okay. So now, here we are. Let's talk about thoracic vertebrae. Remember, you have 12 of those. You had 7 cervical, you have 12 thoracic. All right? The body is not oval, the body is more heart-shaped because it has spots on it that articulate with ribs. Okay? The vertebral foramen is more round, it's more triangular in the cervical. This is the big feature I've said again and again so far, like 3 times. The long, sharp spinous process will point downward. Good? Points down. Now the transverse processes, remember before we were worried about articulations up, articulations down. Now the transverse processes, the ones sticking out to the side, they have surfaces for the ribs to attach. You see that? They have costal is the word we use in anatomy for rib. They have costal. Is, you know, if you're, okay, I'll just keep trying. I know if you were looking at, I know you're talking to someone, and that's probably important, but texting when you're not looking at the board, it makes it hard to know what was on the board. And yeah, you have those PowerPoints in Moodle too, so I understand you can look at them later. But anyway, what I was trying to say, we have vertebra, we have transverse processes. Now we have surfaces for the ribs to articulate with them. See that? We have a rib coming in here, we have a transverse process here, and they articulate. They rub against each other there. So, all right, the transverse processes have these transverse costal facets. A facet, you remember, is a surface. Costal means rib, okay? And this happens with almost all of the thoracic vertebrae, not T11 or T12. They don't have ribs that are articulated on them, okay? So here we have that same table 7.2. Let's look right here. This is thoracic. I already told you the huge feature for that is this. Just like the hole right here through the transverse process would be a big feature to tell you that's a cervical vertebra. The really sharp spinous process is a big thing to tell you it's thoracic, but also the fact that you have a place for the rib to rub against, a costal facet. Are we good? All right. If you look right here, the costal facet is where the rib is going to rub, and we have an inferior costal facet for the head of the rib. So when a rib comes in, it will articulate here and there. All right. Lumbar vertebrae are back vertebrae. Okay? They have most of the stress because you got all the weight from above collecting as you go down. That's why the bodies are really huge. That's why if you have a herniated disc, it's probably lumbar hernia because we're putting so much pressure and weight on them. Does that make sense? You with me? Okay. And it says articular facets lock together to prevent rotation. So when we rotate our torso, we're rotating our torso. We don't really rotate the spine much. The lumbar vertebrae. They don't move a lot. All right. Again, we have table 7-2. You've got to know 7-2. 7-2 is up multiple times. You got to know it. The sacrum, this right here, we've got fused vertebrae that form the sacrum. Okay? So the superior articular surface articulates with lumbar 5, the bottom of the lumbar. All right, the anterior with the 4 fused vertebrae that form the tailbone, the coccyx right here. All right, on the sides, we articulate the sacroiliac joints. Okay, so our sacrum with our ilium. Remember the ilium are the parts that stick out like Mickey Mouse ears? We talked about that before? All right, so where we articulate the ilium, the sticky uppy mouse ears, with what's in the middle, that's the sacrum. Middle, so sacrum in the middle, ilium on the side, sacroiliac joint. Sacral promontory, we'll see it on the next picture, but it's the anterior end, so right there. This part sticks up. The transverse ridges are where we fuse the vertebrae together, where they were separate vertebrae. Okay, and the anterior foramen is going to be on the front side. Right there. Anterior foramen lie at the ends of the ridges, openings for nerves and blood vessels. All right, let's move on so you can see it with the picture. A median sacral crest. Actually, it's the spinous process is fused together. That's the crest. See it? Spinous process is fused together. All right. The posterior sacral foramina, posterior, so it's down to the backside, and the foramina would be the holes. So foramina. Towards the back, posterior. Sacral canal, we continue out, it's the hole in the middle of the vertebral column goes through into the sacrum. And then we have the tailbone, the coccyx, which is 4 fused vertebrae. All right, so there it is. This would be from the front. And it should be from the back. Notice the crest. Like I said, it's fused sacral vertebrae. Good. All right. So yeah, these pictures are just like what was in the text, in the slide before, which was all words. The thoracic cage, we're talking about the rib cage, okay? Thoracic vertebra and your sternum or breastbone. The tip of this would be called the xiphoid process. the top where we're articulating with the clavicles, the collarbones, is called the manubrium. All right. So the sternum and the cartilages form the front right here. On the side, we've got the ribs. This keeps the heart and lungs safe. It supports your collarbone, your clavicle, and your scapula. This is what forms your girdle for the attachment of the upper limb. All right, moving on. Yeah, we got that. Sternum, also called breastbone. I already told you manubrium for the top, xiphoid process at the bottom. If they're not all fused together, they stay cartilage, at least partially cartilage, until late in life, midlife. All right? And it articulates with ribs 2 through 7. Everybody good with that? Yeah? Okay, the sternum has a jugular notch, a sternal angle, and a xyphosternal joint. If you remember that this is the xiphoid process, you know that's going to be down here. So xyphosternal joints, probably that right there. Let's take a look. Okay. I don't like that picture. Let's see if there's a better picture. Here we go. We'll come back to that one. So, this is easier. The jugular notch is right there at the top. The sternal angle is the angle you have between the manubrium at the top and the sternum proper at the bottom. And the xyphosternal joint right there, that's your xiphoid process at the bottom. Okay, so that's good. Let's go back to the picture. All right, it's recording again. I don't know when it stopped. All right, so true ribs are ribs 1 through 7. False ribs are 8 through 10. And then the floating ribs, they're ones that don't attach to the sternum at all. Those are the last 2 pairs, 11 and 12. 12 pairs total. We've already looked at this picture. Let's talk about parts of the rib. Again, the draw it 6 times, 12 times method, that's what I would recommend for the head of the rib. You can learn all the parts. The shaft is a flat bone. It makes up most of the rib. The costal groove is where nerves and blood vessels go on it. So the groove inside of it. The head, that's the part back here that touches the spine. Articulates with fascists or demifascists on vertebra. Okay. Now this is important. It touches 2 adjacent vertebrae. One rib touches 2 different vertebrae. Is that clear? Okay. That's one of the things that keeps the spine from twisting too much, coming too far apart. You've got those things that have to touch. If you put those things together and then you put all those ligaments down the length, you hold it together pretty good. The neck of the rib is a narrow part. The head is the wide part. We use that a lot. You'll see that down here in the femur too. We have a head where it's real wide, and then we have a narrow area we call a neck. Well, on a rib, we got a wide part right here where we're articulating with 2 vertebrae, and then it narrows down right there at the neck. Good? Yeah. All right. And a tubercle is a knob-like structure that is on the side by the head. It articulates with the same numbered vertebrae. So we're talking, then you have a separate articulation for one that matches numerically. Here we have a drawing of one, okay? We're showing it from both sides. So, the head of the rib, wide area, the neck where it's thinner or narrower, you might say that doesn't look different. That picture is showing it like this, thicker at the head, narrower at the neck. All right. The tubercle of the rib sticks down and articulates with that body of that vertebra. And at the other end, by the sternum, where they attach is fused with cartilage. Okay. Now, the spinous process, same. Okay, we've done that. We've talked about spinous process. We've talked about transverse process. The difference here is the transverse process has an articular surface for a rib. The tubercle of the rib is rubbing on that articular surface. The head of the rib is against the body right here with the superior costal facet. Is that good? Clear? You've got two different articular surfaces on this rib, on this vertebrae for the rib. Good? Yeah? All right. And that is a fabulous one. That's the picture that I would be drawing 7 times and labeling all the parts, 8 times labeling all the parts. You know. In fact, that's the best rib picture we've had in this PowerPoint. That's good. And that is the end of this PowerPoint. Now, you're going to do the rest of the axial skeleton lab. That's lab 8. Now you are going to